So welcome to the Center for Total Health. Our name stands for the idea that health is more than about excellent medical care. It's about the well-being of people in a healthy community and a healthy environment. And doctors, nurses, and health professionals shouldn't be part of a sector that participates in health. It should lead society in total health, and sustainability is a health issue. So a few facts about Kaiser-Permanente. This is in our DNA. So Henry J. Kaiser, our iconic founder, built the first steel mill west of the Rockies in 1942 and ordered it to be the cleanest in the United States. 60 years later, we've established a goal to reduce our CO2 emissions by 30% by 2020. In this region, Kaiser-Permanente has purchased renewable energy certificates for 100% of the electricity needs of our facilities in Washington, D.C., which reduces 16,000 metric tons of CO2 every year. Our environmental stewardship work extends to food with $3 million invested in the D.C. area, supporting schoolyard gardens, school salad bars, and universal school breakfast, to name a few things. And locally, just outside, the Metropolitan Branch Trail, behind you, next to you, provides safe physical activity and access to 7 metro stations and was built out with significant investment by Kaiser-Permanente. So we do this every day. On a personal note, I see the commitment of our mayor every day on my walk to work from DuPont Circle. Our city is a model for a place that's safer, greener, and more loving for all human beings. And I've seen it personally in the many places that the mayor goes to be with people to allow them to be their best and achieve their life goals.
So Ted and I represent both the health plan that is Kaiser-Permanente and the Permanente Medical Group. And we have a history of a long partnership of successful initiatives. And today the theme is about partnership, and we welcome all of you to be here with us today and with the mayor to launch this initiative. I'm very proud to say that in the past we've had many successful initiatives working with the DC government. In my past working with DC Human Resources, we've done a number of special initiatives towards workforce health. Several successful initiatives getting people to be healthier and more active. So this is just one more step in our partnership of working with the city. So with that, I would like to invite the Honorable Vincent C. Gray, the Mayor of the District of Columbia, to open with his remarks.
Thank you very much, and good morning, everybody. Thanks, Keith, and thanks, gentlemen, for such a nice introduction. My comment was that this is nice space, and his response was, come back anytime. The fact of the matter is, I do, because I'm a member of Kaiser. I'm in Kaiser probably more than I would like to be, if you understand what I'm saying. In any event, I want to thank you all for coming out. This is really, I think, an auspicious occasion. I want to acknowledge the presence of 2 folks with whom I work every day. Our Deputy Mayor for Health and Human Services, who has done an extraordinary job over these last 3 years, 9 months, 22 days. Bibi Otero. Thank you very much, Bibi, for being here. And the gentleman who is really the leader on our health issues in the District of Columbia, and most recently the work that we're doing on infant mortality. For those of you who don't know, we've launched a new initiative, Stronger Together, which is focusing on bringing down infant mortality from where it is now, and it really had reached absolutely unbelievable proportions and levels. A number of years ago, we were at over 22 deaths per 1,000 live births. We're down now to 7.9, which is actually up a little bit from 2011. 2012 is 7.9, but we know that 2013, as soon as the data are certified, which one would think that 10 months later the data would be certified, but it's not. We'll be in the mid-6s, around 6.6, I think it is, which is probably the lowest we've had in recorded history. However long history may have been recorded. But anyway, that is a phenomenal progress. But we can do better, and we're aiming under Stronger Together to get to 5, which I think we can do by 2020. So, and our health director, of course, is Dr. Garcia. Dr. Garcia, thank you for being here today. again want to thank Kaiser for hosting us today in this really beautiful space. And if you haven't been through Kaiser, I suggest you do that. I'm not the commercial carrier for. Let me put that differently. I'm not the publicist, if you will, for Kaiser, but I do come here, and it really is great care, and I appreciate it. And I want to thank Kaiser for hosting us today as we continue on our quest to focus on healthcare and sustainability. Deputy Mayor Otero and I were just talking briefly about the juxtaposition, the relationship between those two things, and how important healthcare is to sustainability, and how sustainability is important to healthcare. So I appreciate the leadership that's being provided here today on healthcare, and continuing to work with us on our quest to become the most sustainable city in the world. There are a number of organizations, Practice Green Health, the DC DC Hospital Association, the Primary Care Association, and others that are with us. And I think we have probably 20 healthcare organizations that are with us today also to be a part of this. Again, we're delighted to be here. And this is, I would say, the beginning of a partnership. It's not really the beginning. It's maybe a partnership on sustainability issues, but with many of you, we've had partnerships on healthcare for a very long time, and we are, I think, making enormous progress on the healthcare front in the city. Dr. Garcia is focusing, of course, on Ebola at this stage. And we haven't had any cases that we know of yet of Ebola. And I think we are, I don't want to step out there and say something. I think we're prepared. Let's put it that way. And what was that? The best. Absolutely. We're the best, okay. Whatever the best means in this instance. But we are prepared. And we're working directly, Dr. Garcia is working directly with the CDC and others to make sure we continue to learn about this condition, and we continue to take the steps that are necessary to be able to combat this. And we will, like with so many other things, we will find a cure for Ebola. But until then, we have to take the preventive steps that we know exist to be able to stop this dread disease from being spread here and other places across the world. Some of you may know that our goal has been to be the healthiest and greenest city, most livable city in America by 2032, and that would be now about 18 years from now, right? And that time will creep up on folks before we know it. That's why we're taking the steps that we're taking now. I don't know how many of you all have seen, there's plenty of them back there, but our sustainable DC plan. This is, we think, the most aggressive and wide-ranging plan on sustainability in the nation. And if you don't know any different, then just accept that as a fact. It is the most, it is the most comprehensive sustainability plan in the nation. There are 143 actions that are contained in here. And for those of you who have read it, which will probably be maybe one person in this audience at this stage, I actually invite you to thumb through it, because it doesn't take long to get through this, because a lot of these are actions that are laid out. But there are 143 actions, many of which actually focus on health. You know, it's not just rhetoric to say we want to be the healthiest nation, healthiest city in the nation, in the world. It really is a statement of moving forward. And by the way, we also have, I don't know if we have any back there, but this is our first year report on what we were able to accomplish. And of those 143 actions, 80% of them are already underway and moving forward, involving every agency of government with the leadership of our Department of the Environment, which has done, I think, a great job. We have a number of, Keith Anderson, who's our director, is in New Orleans at an environmental conference, but we have a couple of people. Brendan, where are you, Brendan? He's back there in the back having a conversation on some other important subject. I was just acknowledging your presence, Brendan, and I could see the high-level nature of that conversation you were having in the back, but that's okay. I perfectly understand. And we have Donna Henry, who is our Director of Communications for the Department of the Environment. They're both here today to represent what DOE is doing on this. Again, our goal is to become the healthiest and greenest and most livable city in America. And there are actions that have been taken. I don't know how many of you all are familiar with the STAR Communities rating system. How many people in here are familiar with the STAR Communities rating system? Are you telling the truth? I'm just kidding. There were a few people who raised their hand, and I appreciate that. We actually were just rated by them as the 3rd most sustainable city in America. And there are 2 cities that are ahead of us. Northampton, Massachusetts, with which I'm not very familiar, to be honest with you. How about not familiar at all? But congratulations to them for the work they've done. And then the other Washington, Seattle, Washington, is in the top 3. So we don't say we're the 3rd most sustainable. We say we're in the top 3 in America. And we've served notice on Northampton and Seattle that we're coming for them. Some of the things that have taken place that we're really proud of is that we now have more than 100 million square feet of LEED certified projects in the District of Columbia. In fact, there are no buildings built anymore that don't work to achieve LEED certification. And silver used to be the goal that people aspire to, but they've gone past that. Gold and platinum now are the levels that people routinely are aspiring to. You know, I sometimes cite the PNC building. I don't know how many of you have been to that down on 17th Street, but that is a LEED platinum building and has all the features of sustainability that we hope others will aspire to as well. In addition to that, we have installed more square feet of green roofs in the District of Columbia than in any other city in North America. Did you all know that? I don't know about West. And if we can find something that is an even bigger statement than North America, we'll find that and we'll use that, you know, in the future. In the Americas, how's that? We have actually 2 million square feet of green roofs now in the District of Columbia. I don't know if you all know this, but we have actually, the district government made a commitment 2-3 years ago that we were going to purchase all of our power from clean sources. We now have 100% of the power powering District of Columbia government buildings being purchased from clean sources. There is no other government in America that can make this statement at that stage, and I hope others will follow quickly behind in the interest of the environment. 13% of our citywide energy comes from renewable sources. We also, how many of you have been following our bike program in the District of Columbia? We just launched last week. We just dedicated our 200th bike station in the bike share program. We have now, can you believe there's 8.4 million bike rides in the District of Columbia? There are bike lanes all over the District of Columbia at this stage, some of which people like, some of which people don't like. But, you know, we've got to find alternative methods of transportation, and that bicycles will be a part of that. And hopefully streetcars will be an important part of it as well. I've been a big advocate for streetcars. Our council, unfortunately, took 78% of the budget for streetcars out in this last round of budget deliberations. But we will, by the end of this year, be opening the first line in the District of Columbia on H Street. How many of you have seen the streetcars actually running on H Street? They're being tested at this stage, and there will be an actual in-service streetcar running before calendar 2014 is out. We also, and I'll give Councilmember Wells the credit on this, we have a first of its kind bag law in the District of Columbia. And when you go into a store now, if you ask for a bag, you pay a nickel for it. And those funds go then into a grant fund to be able to help clean up the Anacostia River. And again, we also have passed a law, which was ours, to ban styrofoam, use of styrofoam in the District of Columbia starting in 2016, which means that if you, if you go to carryouts like I do, of course, I order very healthy food every time I go to a carry. No grease for me, guys. You won't be able to get styrofoam containers anymore, and that really is a contribution to cleaning up our waterways. Both of those, the bag law and the styrofoam ban, will contribute to helping make our Anacostia River once again fishable and swimmable. Both of which goals people thought were just crazy. But you can start to see how many people in here have ever taken the ride on the Anacostia River from Bladensburg down to the Sousa Bridge. You ought to do that. Honestly, I'm being quite serious. You ought to do that. Go one Saturday morning up to Bladensburg, get on the boat, and come. You won't even think that you're in the city. You won't even think that you're in the District of Columbia. And one of the things I noticed was when you get to where get to the district line, the water starts to look cleaner. A lot of people don't realize that only 18% of the Anacostia River is actually in the District of Columbia. 82% is in Maryland, and if we can get our partners from Maryland to join us even more, we will be able to clean up the river even faster. And if you look at, when you read this, I know you're going to rush right home and read this, but when you do, you will find that by 2032, our goal is to make the Anacostia, the condition of the Anacostia is such that people will be able to swim in the Anacostia and be able to fish in the Anacostia and eat what you get. And you're saying like, yeah, Gray, what have you been smoking? But it really is possible, ladies and gentlemen. So again, we want to thank you all for working with us in this partnership. We have signed on, believe it or not, we've signed on 8 colleges and universities, over 80 embassies, and other international institutions, and 16 businesses representing 114 buildings in the District of Columbia. And the goal is to keep doing this until we've gotten everybody engaged with sustainability in a meaningful way in the District of Columbia. Our healthcare institutions have really stepped up already, even before signing this pledge. For example, Patrick, I think you know that we have a green roof at the new hospital, still relatively new hospital at St. Elizabeth's. George Washington University is committed to solar power, and we appreciate that. Vince, Unity Healthcare has committed to focus on healthy eating. And of course, Kaiser's Center for Total Health is yet another example of what we've been able to do. We want to focus especially on what you all are already doing. This is just another way of focusing, and that is on reducing obesity, which is one of the health conditions that continues to be a challenge. High blood pressure, asthma, and other illnesses that are actually linked to the environment. And frankly, they are exacerbated in some instances by the condition of the environment. We have today, I think, 20 hospitals and primary care clinics and healthcare institutions, organizations that are signing on to this sustainability pledge, which is marking an important step forward. We will continue to focus on climate change, and I think everybody, the day will come. It won't be today, it won't be tomorrow or next week, but the day will come when people will say what the folks in this room have done to focus on sustainability has really markedly improved the quality of life for people in the District of Columbia and for the yet unborn, which I suspect Dr. Garcia will probably contribute to continuing to bring down infant mortality in the city as well. All of these things are linked. It's just a matter of stepping back and recognizing the linkages that do exist. And when you do, it makes it even more important and more compelling to be able to focus on things like we're talking about today. So I want to turn now to the organizations. After we finish the signing, Vince, I'm going to ask you to come up and say a few words in closing comments. I always look forward to being with Vince Keene because together we are invincible. Pretty bad, isn't it? All right, I'm going to ask you, and I know many of these organizations are here. This is our pledge right here, right? And we're going to come up and sign it. I assume that everybody has read it, so I'm not going to go through all of this. But the essence of it, of course, is to sign on to the commitments that we've talked about already. First of all, George Jones, Bread for the City. Come on up, George. Sir. Mm-hmm. Okay. George. We have an inspection team also that will be visiting your places to make sure these plaques are on the wall, all right? And if your plaque is not on the wall, you will be subject to a sustainability suspension. Kurt Newman from the the Children's National Hospital Medical Center. I just want to tell you what a great job Dr. RC is doing on this. Yes, sir. Thank you. Kelly Sweeney McShane from the Community Health. We were just at Kelly's place a few weeks ago for the announcement of Stronger Together. Kelly. Timothy Walker, Elaine Ellis Center of Health.
Very good to meet you, sir.
Anita Jackson from the Family and Medical Counseling Services. Wow, that's some signature. I got to do one of those. Zip! My handwriting is already illegible enough. All right, Amy Mendoza from the George Washington University Hospital. Okay, Terry Thompson, representing Howard University Hospital. John Mathewson from the HSC Pediatric Center. By the way, if you all haven't figured this out already, by the time we finish, everybody who was sitting there will be standing over there. I'm going to mispronounce his name. William Bowdle? Bodell. Okay. Bowdle? Well, that was close. Yeah. Thank you. Kaiser.
Yes, thank you.
Is anyone here from La Clinica Del Pueblo. Fantastic. You can tell us your name when you get up here because I don't have it. There you go, you tell them.
I'm Alicia Wilson with La Clínica del Pueblo. Thank you so much.
Okay. Is it Lida? Lida Venegas? Did I get the last one right? Come over here, we missed her. Okay. Regina, you're representing two today. You're representing the Georgetown University Hospital and the National Rehab Hospital as well. Thank you for being here. Two-fisted. You know how to pronounce this one? From MedStar Washington Hospital Center, Catherine Mange, okay. Michael Thompson from Providence. Patrick Canavan from St. Elizabeth's Hospital. Patrick.
Thank you. Appreciate it.
Allison Arnott from Sibley. Did I pronounce that correctly?
Yes, you did. Thank you.
Pamela Lee from UMC, United Medical Center. And from Whitman Walker, which has a big event coming up this Saturday, right, Don? I was glad to see the commitment to ending HIV. That is very promising. And Don Blanchard.
Thank you. No, thank you very thank you so much. Join us Saturday morning.
And Vince Keene from the Unity Healthcare.
Thank you very much.
I see, well, I guess I better sign too.
I guess as the closer, hopefully it's the ninth inning, right? And if I'm like Soriano, we're in trouble, right? I want to thank the mayor and the District of Columbia leadership and the Department of Health for their great leadership in just basically leading all of us in this partnership. And I just saw DC moves yesterday. He has plans for 40 years from now. He's very optimistic about being alive at that time, you know, but I really appreciate the leadership on that. 25, oh, not too bad, no, yeah. 25 years, yeah, we can do that.
But part of that is our 2-year plan.
That's right.
Also.
That's
We'll
right.
all be around in 2 years.
Right, we hope, right? I also want to thank Dave Levy because maybe after this he won't be after me as much, but I really appreciate his work. And I speak on behalf of the community health centers that have, many of them, like ours, have new buildings and have been LEED certified. I know Community Hope and others. So, and we certainly are key in improving health. And I think we realize, probably more than anybody, and the providers realize, that what happens in the clinic is a very small part of the healing that goes on in the lives of people who come to us. Basically what happens outside the clinic, their exposure to illness, their poverty, the conditions in which they live are so hard for us to solve, but yet as providers we must be engaged in addressing the social determinants of health. The ones who have helped shepherd this for me have been my providers and one of my aggressive residents there. And they told me about the impact of pollution on children with asthma, the impact of roaches. I never kind of thought of that, roaches in homes and the impact that has, the impact of just car pollution. And I just kind of think that's critically important for us to realize the connection. And thank you, Mr. Mayor, for bringing that connection of a clean environment to a healthy DC. We actually do a few things that I think are innovative. We do a Park RX prescription, which is really basically a physician, usually, well, any physician, prescribing that they walk in the park. And we have identified something like 200 parks that are available to people for children. And we are seeing outcomes around obesity and general improvement in health. And we want to make that citywide, or unity-wide, and make it available to the city. And it's really cheap. It's for nothing. Dr. Czar has been key in this. And DC Greens, where we prescribe through the aid of DC Greens and WAVE, I can't think of their full name, but basically they provide prescription, $60 for prescriptions for people to go to markets in the neighborhood. Very exciting. Waste is a big thing that we all deal with. If you get a chance, go and see The Big Lie. Anybody see it, the movie? It's about 3 young Sudanese who come over here after the lost children back in the Civil War. There's a scene in that movie where the young man, who's the Sudanese, working in a grocery store, and he's told by the manager to bring out all the unused food that has been outdated. And he sees him, he's told to put it into a waste dumpster. And I mean, the young man cannot believe that this is happening because they're starving in Sudan and other places. And it is so impressive to see the values that he brought with him. And in fact, there's a homeless woman, and she comes to the waste dumpster. And he says, don't do that. He said, I have fresher food here. In other words, he's bringing out another basket. And of course, he just says, I can't work in an environment where this waste is going on. I think all of us have responsibility. We're told by Secretary Kerry that the next real war will be around hunger and the impact that climate change has on us. So thank you, Mr. Mayor. Thank you, the district, and thank you to my partners, because we are honored. Now the real work begins as we try to implement this. Thank you very much.
When Vince was talking, it just reminded me of something also when he talked about obesity and exercise and whatnot. We launched a couple of years ago, started out with 8 playgrounds, and then we found money for more playgrounds. We got 24 more, we got it up to 32, and then we got money for more, and we got it up to 40. We have actually either modernized or created a commitment, if you will, to 40 new playgrounds, and 27 of them are finished now in the District of Columbia. And if you ride around the city, you will see the impact, and it's all across the city. It's not just in certain areas. Every ward in the District of Columbia has had the experience of having new playgrounds being built, and there are 13 more to go which are underway, and they will contribute to combating obesity, because it'll get our kids and frankly our families too out doing things that they otherwise might not do. And they've been designed in concert with the community. Everyone has his own unique theme, and those themes have been translated then into architecture and the upgrading, if you will, of our playgrounds in the District of Columbia. So I'm going to free these guys from bondage over here. Yeah, you all are literally out of sight and out of mind, right? So if you want to come back over, our program is finished. Thank you all very much for coming out and being a part of this really important occasion for us today. Thank you all for being here.